Hi, everyone, and welcome to the Chicago Coalition for Family Building Spring Application Cycle. I am Dr. Eve Feinberg. I'm one of the founders and the president of the Chicago Coalition for Family Building, and I am joined by one of our amazing volunteers, Laura Wepler. Laura, have you introduced yourself?
Hi, everyone. My name is Laura Wepler. I am a fertility clinic nurse and now run my own practice, Navigating Fertility with Laura, where I support patients through their fertility journeys. Check me out on Instagram at Navigating Fertility with Laura, or you can visit me at yourpocketfertilitynurse.com for more information.
Yeah, and Laura's amazing. I worked with Laura for many years as a fertility nurse, and she's fantastic. So, I want us to run through what the coalition grant cycle looks like, what the application looks like, try to preemptively answer any questions that folks might have. But if you are going through the application and you're really struggling with something or don't know the answer, please email us at grants@coalitionforfamilybuilding.org, and we will do our very best to get back to you within 72 hours. Please note that everyone who volunteers with the coalition is a volunteer, and so we're often answering emails at odd hours and may not be immediately available upon your email, but we will get back to you as soon as we can. So, starting out, the way to get to the grant application is through the coalition homepage. And there are actually two places that you can go to, and that's coalitionforfamilybuilding.org. On the very homepage, there's a button that becomes active when you hover over it that says apply for a grant. And then also on the grants page, there's another button that goes live and you can hit apply now. So Laura, go ahead and hit that. And once we hit that apply now, it takes you to the landing page for the grants. And that purple button is how you start the application. Um, and then we have several different types of grants. So you can either hit that start application or you can go to each specific grant listed and you can apply. So just to give you a little bit of overview on each one of our grants, we have several grants that we're offering in this spring cycle. So the Chicago Coalition Adoption Grant is for individuals or couples who are looking to adopt a baby. And we have two different adoption grants. One is through the coalition, the other's through our partners, Jewish United Fund Path to Parenthood. And in order to apply for either of the JUF grants, you have to either identify, you or your partner, if applicable, has to identify as a member of the Jewish community or have strong ties to the Jewish community in some way. In order to be eligible for an adoption grant, you have to have already completed your home study. The next grant that we offer is a financial grant, and that's a Chicago Coalition financial grant. And that is for patients who need money to help with the cost of family building. So this grant is ideal for somebody that needs to pursue IVF who maybe has partial insurance coverage, lifetime max, may need some money for medications, maybe doing pre-implantation genetic testing, might have insurance coverage for their IVF cycle, but needs funds for PGT. Or conversely, you have a medication max that you have hit and you need up to $10,000 for more medications. This cycle is not ideal for patients that have no infertility coverage and who need to do IVF. For those patients, if you have no infertility coverage and you need to do IVF, then you are best applying for a Chicago Coalition donated IVF cycle grant. So the coalition really gives two types of grants. One type of grant is a financial grant up to $10,000. The other is a donated cycle grant, and this is with one of our partner practices where each practice donates one IVF cycle per year to the Chicago Coalition. We try to preferentially award grants to those patients who are existing patients within each practice, but occasionally that doesn't happen, and we may send you to another practice. The IVF cycle grants are inclusive of morning monitoring, egg retrieval, embryo transfer, do not cover the costs of anesthesia, freezing embryos, long-term storage of embryos, or for pre-implantation genetic testing. But the value of this grant actually exceeds $10,000 because the cost of an IVF cycle can range from 12 to 15 or $20,000. And so we strongly encourage patients who have no insurance coverage to apply for a donated cycle grant. The financial grant, again, is up to $10,000. The JUF Path to Parenthood grant is just like the Chicago Coalition financial grant, except again for members of the Jewish community. The applications for the JUF grants and the Chicago Coalition grants are more or less the same, and all of the grants ask for similar questions. New this year, and I'm really excited to announce our partnership with the Carlos Rodon Foundation. New this year is the Willow Grant, and the Willow Grant is specifically for couples who have experienced a miscarriage who are trying to build their families after miscarriage. And this is a beautiful partnership with Carlos Rodon and his wife, Ashley Rodon, who suffered from miscarriages and then went on to have a baby after miscarriage. Carlos used to be a White Sox player and is now a Yankees player, and they have strong ties to Illinois. And so I partnered with the coalition for this grant, which is rooted in hope. And our final grant is the Magnolia Tree Foundation grant, and this is specifically for patients who carry one of the breast cancer mutations, BRCA1 or BRCA2. It's in honor of Alexa Rodheim, who is Diana Rodheim's daughter, and lost her life too soon, secondary to breast cancer. And this grant is really in her honor, and it's to fund the genetic testing costs for pre-implantation genetic testing with BRCA. So let's start the application and we'll walk you through it and try to preemptively answer questions. Laura, is there anything that I missed in that?
No, I think you covered it really well. I think we'll start here at the start application. We'll show you how you can select a different grant. I think I need to go to apply. All right, here we go. So, what I was going to say, I can't remember. Edit this out.
Okay, I will do my best. And
Okay.
apologies if my editing skills are not great. So, just a couple housekeeping items. The grants are due May 31st at midnight. There are no exceptions for this application, and that's in the spirit of trying to be fair. We realize that some people may be applying for a grant now, mid-April, and we want to make sure that we are able to decide the grants in a timely fashion and award the grants in a timely fashion. And so that deadline is firm. There are some medical qualifications that you have to be aware of, and those are all outlined in our on the website. You can see the particulars of that. So moving on to the application itself, I want to highlight a few things about the application. So once you go to apply the oh, sorry, trying to notify my phone, silence my phone. So once you go to apply, the first thing it's going to ask you is category, and you can only apply for one grant. So that drop down is going to ask you to select which grant you are going to apply for. So let's start with the Chicago Coalition Financial Grant because it's actually the lengthiest grant application of all of our grants. So please note the eligibility criteria that you have to have a diagnosis of infertility, and that really applies. The definition of infertility is the inability to conceive without medical assistance. So that may mean that you're in a hetero relationship and you've been unable to conceive after a year of trying. That may mean that you're in a same-sex relationship and you've been unable to conceive without medical assistance because you need donor sperm or donor eggs or a gestational carrier. All of those qualify for the medical diagnosis of infertility. We do have some age cutoffs and criteria, and that these are prognosis based. So the way that the scoring works for the application is grants are selected based on patients who have the highest likelihood of having a baby, 55 points in the application goes towards that. And then 45 points of the application goes towards your personal statements. So we really want you to put a lot of thought into why you should be selected as a grant recipient and who you are as a human and a little bit about your infertility journey. If you're applying for a Willow grant, we want to hear about your miscarriage journey and how that impacted you. We know that the impact of miscarriage is significant. So I really want to highlight that almost half of the application scoring is in the personal statement. And so you can have kind of a guarded medical prognosis, but have a really compelling reason why you should be selected for a grant. But we don't know anything about you unless you tell us who you are and why you should be selected. So I really want to highlight that's a hugely important part of the application process. The other couple things to note is we give grants, we keep in touch with the recipients for, we'd like to say forever. Once you build a family, you're part of our family. And so we like hearing updates. We do require that all individuals who apply for a grant and are selected for a grant are willing to have their photos on our website. We don't use last names, but we do require a photo and a bio at the time of application that's going to be used on our website. And the whole way that we are able to give these grants is by fundraising, and we raise money from the community and we track our outcomes and we take that really seriously. And so I think the first question you should ask yourself is like, are you willing to go public with your story and share your story? We really feel like infertility stigma should not exist. And a huge mission of the coalition is to break that stigma down and have infertility as part of our everyday conversation. So we occasionally will have somebody who's awarded a grant and then they realize that they're not comfortable sharing their story. And so we ask you to really think about that up front. And if you are not comfortable sharing your story, there are other grant programs that you can apply to that perhaps don't have the same requirements. But part of what we do is we want to break down those barriers and break down that stigma and really show the world how important family building is and that infertility in many instances is a medical disease, obviously not for same-sex couples, it's not a disease, but how infertility is a disease and it deserves the same treatment and credit as any other disease that's out there. So, okay, so once we
I
select
just
our,
want to add too,
yeah,
Faith, it is National Infertility Awareness Week. So it's the perfect week, right, to be launching our application and for people to gain awareness about infertility.
yes, yes, and that is very intentional in the timing of when these grant cycles open. Thank you for highlighting that. So let's go to the grant. So we've selected a coalition grant. There's a lot of notes in there. Everyone needs to give their application a name. We encourage you to just put your name there.
We're just going to do tests. That's my new
That
last.
sounds that sounds great. Laura Test. Um, so one of the requirements for because it is the Chicago Coalition is that your medical provider is located in the state of Illinois, and that's especially true for the donated cycles. The exception to this is the Willow Grant, where you can live in Illinois, Indiana, or Wisconsin in order to receive a Willow Grant. The other part about our application is we do restrict our applicants to those people that have 0 or 1 child. And if you have 2 or more children and you are trying to have a third child, we certainly don't want to minimize the heartache and struggle that comes with that. But our mission is really, because our funding is limited, is really to help people build a family with 1 or a second child. So once you do that, you check your eligibility. The grant will tell you, yes, you are eligible, and you can go on to complete the application. As you can see at the top of the application, it's organized into tabs. At any point in time, if you start the application and you can't finish it, you can always go and save your application and come back to it later. So you would just go to the bottom and you would say save and close. We're going to run through some of these questions. We ask you for your full name, your email, your mobile phone, and that's because hopefully you get awarded a grant, and we like to keep your phone number so we can call you and let you know. We do ask for your occupation, your employer. We want to know what gender you identify at and what pronouns you want us to refer to you as. We also want to know your date of birth, your current age, and then whether or not you have health insurance that has any fertility benefits. And again, for the donated IVF cycles, you cannot have any infertility coverage. Otherwise, you do not qualify for that grant. If you have health insurance that has fertility benefits, Laura, if you could click yes on that, we're going to ask you what your coverage entails. We try to meet the needs and try to fill in some of the gaps um, in that. And then we do feel like our military is a vital part of our country. And so we do ask about military service, and we always try to support our service members as best as we possibly can. And then we also want to know if you're applying for this grant partnered, or if you're planning on using donor gametes. If you are applying with the other person, and say you are a female applying for the grant, then we're going to ask about that other person, who they are to you, what your relationship status is, information on that person, how old they are, what their gender is, and what their pronouns are, as well as their sex assigned at birth, what their occupation and employer is, whether or not your partner has fertility benefits, and whether or not your partner has served in the military. So we can go to the next section. This next session really helps us to identify what are your needs. So in certain years and certain times, we also get some ancillary services that are donated. So for many years, we've had a partnership with Natera, who's a genetic testing company, and they also grant PGT cycles to the coalition. And so sometimes we're able to tag on for patients that are doing IVF with PGT. Sometimes we are able to tag on, you get a donated IVF cycle and you get PGT. For many years, we've had a relationship with Serono, who has generously donated medication. So we may see that you're asking for IVF, which means that you need IVF, and presumably you need the medications that go along with that. So we're also really interested in knowing, are you using your own eggs? Are you using donor eggs? Are you planning to carry the pregnancy? Or are you using a gestational carrier? We realize that sometimes couples have undergone IVF previously. So if you have, we ask for information on that. And if you already have frozen embryos, please note that once you have 3 euploid frozen embryos, the grants cannot be used solely for embryo banking. Our focus and our mission is really to help people have their first child or their second child, not to bank as many embryos as they can at a young age, as young of an age as possible. So again, this is all sort of based on prognosis and the likelihood of success. We're trying to ascertain who's an excellent prognosis candidate, who really has a high likelihood of having a baby. And as I mentioned before, our scoring system is geared towards a prognosis-based scoring system, but that's only half of the application. And so we also want to know if you've previously applied for a grant through the coalition. There are many times that we preferentially give a second grant to the same couple, because we really want to help couples get to that finish line and have a baby. And similarly, for those couples that had one baby through the coalition, we really want to help them have a second baby. So we do ask that information. So if you want to go on to the next question. I don't want to call it an optional section, but if we're unable to get a reference from your physician, it does not count against you. But if you can get a strong reference from your physician, it can really boost your application. So we ask you if you're working with a reproductive endocrinology and infertility specialist, who they are, what city they're in. Please note you have to be seeking treatment in Illinois for the majority of our grants. If you are using donor egg or a gestational carrier, we ask if you're working with a third-party agency and then who that third-party agency is. The third-party agency does not actually have to be in Illinois. It's just your medical provider does. We want the name of your medical provider, and if possible, we know it may be difficult to get their email address. If you are unable to get their email address or your nurse's email address, then you can put in grants@coalitionforfamilybuilding.org as the email, and we will forward it. We have the emails for all of the local physicians, but ideally, it would be best to get the email address from somebody at the clinic who can fill out the reference form. And that reference form will then go directly into your application and can boost your application score. So let's go to the next section. And this is really the medical. This is the financial information section. So we do not have a strict financial cutoff, but we do want to make sure that we are giving grants to people who have demonstrated financial need. So we do ask for income, W-2, and tax returns, and whether or not you file individually or separately with your partner if you have a partner. We do verify your photo ID, we verify your tax return, we verify your W-2, both for you and your partner. I do want to point out that the platform that we use, Good Grants, is extremely secure and has a lot of safety measures in place to keep your personal information secure. Um, and then the next section is the medical information section. So we really want to understand a little bit more about your medical diagnosis, what your reason for infertility is, whether or not you've been through IVF before. Are you using your own eggs? Are you using donor eggs? If you are using your own eggs, we ask about your AMH, which is a marker of egg supply. We also ask about your estrogen levels, and then we require that you upload your medical records from your clinic to show us what those levels are. If you are someone who has infertility but have not yet been to the doctor to explore the reason why you have infertility, this is not the right time to apply for the grant. So the grant should be applied for once you have a certified diagnosis of infertility and you've completed your tests and you know exactly what type of treatment you will need. And then we do require for the person who's carrying the pregnancy, some sort of a uterine cavity evaluation, either a saline ultrasound or a hysterosalpingogram. We do ask whether or not you've had C-sections, whether or not you've had miscarriages, as that can impact your uterine cavity and your ability to carry a pregnancy. We're going to go to the next section. And this next section is really the heart of the application. I know it looks really short. We do put 1,000-word limit on this section, but we really want this to be the heart of who you are, what you've been through, and why you should get a grant. This is really the crux, and this is really the distinguishing feature. We've seen some applications from some people who have really good medical prognosis and they just don't fill out the personal statement and they don't get a grant. Like we feel like this is the meat of the application, and this is how we really decide who gets a grant and who doesn't get a grant. So if you have questions about other things that are needed in that personal section, feel free to email us, but it's really just supposed to be from the heart, who you are, and letting us get to know you so that we can advocate to help you and support you and learn a little bit about your backstory. The final section is really just photo. One thing, one thing that I forgot that Laura is pointing out to me is we do want our grant recipients. So the whole way that the organization sustains itself is fundraising, and year over year, we have various methods how we help support the coalition. So we do not have grant foundation donations. Like this is a very grassroots effort. Our most common donation is actually $100 that friends and family donate. We have an annual 5K run. We require that our recipients come to the run, volunteer at the run the run. We love when you set up fundraising teams, but we really want our recipients to be involved in this organization. And so we ask you, how will you contribute to the coalition? How will you become a part of our family once we've built your family? And that's really the other key to this. So it is who you are, how you're going to advance the mission of the coalition. This is not just a grant where we write you a check and you walk out the door. This is really a partnership that is mission based to break down the barrier of infertility and to pay that forward so that the next people who are struggling to build their families, so that we keep the organization sustained, so that the next person can have the support and the financial means necessary to get their grant so that they can build a family. Often at our race, it is my favorite day of the year. We have grant recipients who now have 5-year-olds, 6-year-olds, 7-year-olds. We've been in existence, and our first grants were awarded in 2015. So it is one of the happiest days of the year when we get to see the children that have come as a result of our work. And I think it's just, we want recipients who feel that passion for the organization, who want to carry this mission forward. Um, and so, the final section is just your photo and a bio. Feel free to look on the website and see like what photos and bios look like. They're just a paragraph and a photo. It can be a silly photo, it can be a serious photo. It's really just so we get to know you, and our future donors and people who are perusing the website can get to know you. Um, I'm trying to think if there's anything on any of the other applications. This is definitely the most in-depth of all of the applications, but the applications are sort of built foundationally from the same uh, basic template. There are some nuanced differences in the essays for the JUF Path to Parenthood application, and there are some nuanced differences in the Willow Grant application essays, but more or less, this is the crux of what we are asking you to do.
Yeah. I would say for the adoption grants, we're not going to ask about medical history and fertility history. So one less tab to do if you're applying for one of those grants. And then also, I think we want to highlight, I can't submit because I didn't complete all the fields, but there is a $35 application fee once to actually submit the application.
Wonderful. And so if you have any questions about the grant, I'm hoping that this was really helpful so that you understand how we work. There's a lot of thought that goes into this application. I want to give a huge thanks to Laura and to our other volunteers, Elise and Ashley, who have helped to build this application. This is not easy, but there's a lot of thought and there's a lot of purpose that goes into this application. Once the application is complete and once we've hit our deadline, each application gets reviewed by 2 medical advisory board members. The medical advisory board is comprised of board certified physicians from the city of Chicago. We span all practices, and each application gets scored by 2 people. The scores get averaged, and then the highest score applicants get the grants. We really try to be equitable and fair and thoughtful in who we select as a recipient. And if you have any questions, please do not hesitate to send us an email. We would love to help build your family. Thank you.
Thank you.